Hi, good afternoon. I welcome everyone for this webinar, a dialogue on expectations and challenges of persons with disabilities during COVID crisis. Uh, it's a webinar which is co-hosted by National Institute of Urban Affairs and Department for International Development of the UK government. And on this note, I welcome the co-host of the event, which is Mr. Hitesh Vaidya, Director NIUA, and Ms. Mamta Kohli, Senior Social Development Advisor at DFID. A very good afternoon, and uh, with this, I think I'll just quickly highlight the objective of the session, which is to understand the expectations, challenges, and concerns of the vulnerable groups, especially persons with disabilities, and relevant stakeholder institutions, and identify pathways for integration into the pandemic resilient cities, both in terms of designing the cities and also planning process itself, which is an ongoing, I guess, I think across the globe. And we would like to make use of this opportunity to identify the pathways towards that. And I would like to start with the introduction of both the co-hosts. I have with me Mr. Hitesh Vaidya, who has recently joined as a, I would say, in the month of August last year, so fairly some time back. And Mr. Vaidya brings in more than 20 years of broad-based urban development and policy work and formulation experience, and also program management, mainly with a wide variety of agencies, which is United Nations, World Bank, and USAID. And prior to joining NIUA, he was a country representative of the UN Habitat in India. And I have with me the second for the event, which is Ms. Kohli, who happens to be the senior social development advisor at DFID. And Ms. Kohli, with her, brings experience on a wide range of topics in development sector, which includes education, health, nutrition, women empowerment, skill development, and also with the primary one of our primary focus being target beneficiaries being persons with disabilities. And we welcome you both to the panel, and we look forward to your contribution and deliberations on this panel. I would like to now move on to the esteemed panelist of the session, which is I'll start in the order of Mr. Dipender Manocha, who is a developing countries coordinator and also the lead of training and tech support for the DESI consortium. Mr. Manocha, I would request you to slightly elaborate on what the DESI consortium is, and your contribution while you start speaking at the point of uh, the leading questions when Mr. Vaidya hands it over to you. And he is also the member of the executive committee of the World Blind Union, and he is currently the managing trustee of the Saksham Trust. We welcome you, sir. And now, Dr. Shanti Alok, chairperson and one of the founding members of Muskan, an NGO which is based out of Delhi, primarily formed by parents and professionals to provide needed services for improving the quality of life of intellectually challenged children and in adults, and also emotional and knowledge support to the parents. And we welcome you, ma'am, to the forum. And we have Mr. T.D. Daryal. I'm sure I think you might have heard about this name in the Delhi circles quite a lot. He has served as a Deputy Chief Commissioner for Persons with Disabilities, Government of India, and also State Commissioner for Persons with Disabilities, Government of NCT of Delhi, for about nearly 17 years. And he has a Master's in Business Administration from University of Hull, which is in United Kingdom. And then he is now currently working as an advisor to the CBM, a Germany-based disability and development organization, so more than 100 years, and also the director of CAB Foundation, CABE. I would request you, sir, when you actually start elaborating on some of the leading questions, to briefly highlight on your current work at CAB and CBM. And finally, I have with me Ms. Pratishtha Deveshwar, an inclusion and accessibility rights advocate, again a very known face in the sector, and she has been a speaker around the world at various United Nations events also, and she is currently pursuing a political science honors from Lady Shri Ram College for Women at Delhi University, and she is the first wheelchair using Indian to study at the University of Oxford, where she was pursuing a Master of Public Policy. A very warm welcome to all of you, and thanks for joining us for this afternoon session. And also very warm welcome to the participants who have joined us from various parts of the world, and all our national and international partners, representatives, and also relevant stakeholders within India. Uh, so, like I mentioned earlier, I think that broadly the webinar is highlighting the fact for need for integration of tenets of inclusive development into the resilient cities framework, especially in the context of pandemic like COVID. And I'll so that's a broad context I would say, and then I do have some housekeeping list before I hand it over to the co-host for the day, which is Ms. Mamta and Mr. Vaidya. So one of the thing is I request everyone who is not speaking at this moment, and while the others speak, please keep your microphone on mute just to make sure that we have an opportunity to listen to the esteemed panel, while they share their experiences and stories. And the platform has a very like a minor delay. So it's a less than 10 seconds delay. So you might see some kind of a latency in audio and video. So kindly bear with us. And it also depends upon the internet connection that you have. So just wanted to highlight that upfront. And for the benefit of the beneficiaries that we are working for this under this program, and also for the larger stakeholders that we have on the participants list, and also widely going to be used later on. The entire webinar is made as an accessible and an inclusive event. And for attendees with hearing disabilities, we have with us Manisha and Atul to support us with the live sign language translation of the discussion. Thank you, Manisha and Atul. And also, in addition to that, the platform also offers other accessibility options like large fonts, high contrast, and closed captions, all of which are available in the settings section of the application of the BlueJeans. And these are available to the attendees, the panelists, and I request you all to make use of that. And broadly, there are two types of panelists that you see in the screen right now. There are panelists who are going to be sharing their experiences and also engaging with us in a kind of a enriching conversation about how do we work towards pandemic resilient cities while taking inclusive cities on designing and planning process. In addition to that, we have a couple of co-hosts, and I'll be there as a kind of a background moderator for supporting both the co-hosts as and when there's a need. And in addition to that, we do have chat options on the application. So I would request all the participants to make use of the event chat and put in their questions. There's going to be a moderation and a live response to the questions. And in addition to that, the moderators itself, the panelists itself also has a chat window that can be used for engaging on a conversation while they are on the panel. And to type in your questions, I request you all to submit a question to the presenter by giving either tagging the presenter, or you can directly put it up for an open forum. And in between the webinar, we are going to also post some polls, and we request you all to take part in these polls and give your feedback on what would be the right response to a particular poll question. And in case if there are attendees who would like to make a kind of a live question to the panel, I request you all to raise their hand. And when towards the end of the session, there's a live question and answer, and we will be enabling that towards the end of the session. And in addition to that, I think if there is any technical snag or a power failure, entire event is being recorded, and we will be sharing it with all the registered attendees. And along with this, there's going to be a survey and a collateral which will be shared as a follow-up. I'll leave it there. I think again a warm welcome to everyone, and over to you, Mom. Thank you. We request you to start with your brief on
Thank you,
COVID
Nanda.
initiatives and also set the context for today.
Yeah, yeah. Thank you, Nanda. Thank you, panelists, and thank you, everybody who's attending this webinar. Post-done sessions, we always used to dread, but I think we welcome this one because it's on a very, very pertinent topic, something that we all very passionately believe in. Um, so as Nanda said, this seminar, this webinar series that we are planning under our partnership with NIUA is really looking at how do we use our personal insights, our experiences, and how do we use them to shape policies and programs and interventions at the city level. This is not something new. This is not something when your constitution, the 12th schedule, very specifically mentions this about safe the link, currently the weakest. And I think post-COVID, I don't want to dwell too much on what COVID has done and what COVID experiences has been, because we'll hear it from the participants. But we all recognize that the road to recovery is going to be very long. There are a lot of going to be this new terminologies that have come around, new normal and building back better. What does it mean in real terms from a city's perspective? All these are things that we need to unpack a lot more. And what we realized is that if we don't actively look at it from a disability lens, many times we assume things are done and things are accessible and things are equal for everyone, but actually they're not. So it's very important to really bring that out more and more clearly. Around 2 years back, around this time, UK hosted the Global Disability Conference. And post that, we really deepened our work in India on disability, specifically on 3 areas. One is, of course, inclusive cities, under which we are sitting here in this webinar. The other one is around economic opportunities, especially focused on skills training. We have Shanti ji as one of our partners, looking at intellectual disabilities in particular, looking at how do you build employers' awareness and make them more sensitive and recognize that, yes, you can employ people with disability without any loss in productivity, perhaps.
Mamta, your microphone is on mute.
So these are the 3 things that we are working on. Was I mute for a long time?
I think you might have to repeat the 3 things broadly.
Okay, so the 3 things, like I said, were the inclusive cities under which we are sitting here. The second is around economic opportunities, especially focused on skills development, employer engagement, making employers more sensitive to the opportunities that they can provide and how they need to build their own systems to provide opportunities. And third is around assistive technologies and innovations. How do we make them more affordable, accessible, and scalable? How do we create a genuine market around it? Simultaneously, we're also looking at how do you visualize and create role models and give them a space in any of the events that we have, and build more around research and evidence. So our partnership with NIUA under this BASICS program, which is building accessible, safe, and inclusive cities, really focuses on 3 areas. One is around policy gaps, looking at where do we need to build a better connect around city policies and making sure that they're looking at all aspects of accessibility across. The second is looking at how it is across the urban delivery system, whether it's your executive engineer, it's your junior engineer, it's your commissioner. How do you build those capacities? How do you integrate this as part of the core work that happens around their capacity building? And third is around not just sharing good practices, but actually picking up a city or two to demonstrate those practices. So, for example, you with the city of Varanasi to see what is it that we can do, infrastructure they are planning and some of the infrastructure that already exists. But just like most things have been hit by COVID, obviously the progress has been affected by COVID.
Good afternoon and a very warm welcome to all the panelists and participants of this webinar. We all are here because we all have seen that COVID-19 has very clearly highlighted the renewed focus and the renewed discourse of making housing, transportation, public spaces inclusive and accessible. And as Mamta very rightly said, that while we have a national and global commitments on accessibility and inclusion, the challenge is to ensure that it is effectively implemented. And I think this series of webinar, the idea here is to discuss and have a dialogue on how to bridge the gap between the policy and practice at the local level, and also how to take the specific steps towards inclusive and accessible cities from the practical standpoint of view. We all are talking about new normal, which Mamta also talked about, and the building better cities. So that's why I would request, we will have 2 rounds of questions, and I will request each panelist to share their diverse experiences so that we can come up with the actionable interventions, which we can start influencing the discourse at the city level to applying the accessible and inclusive lens. As the broad objective, I think Mamta has already talked about 3 points, is how this webinar can contribute towards the policy discourse on making cities more accessible, how we can support building capacities towards mainstreaming accessibility and inclusiveness in the design and planning of cities, and last, how we establish a forum for experience exchange where we can really talk about scalable and innovative instruments which can then be used to replicate across the city. So these are 3 broad objectives, and I'll start with Mr. Manocha. Mr. Manocha, we have now from 24th March till today, we have seen whole COVID, literally stopping our city activities. And I can really see that the challenge when we talk about poor and informal sector, but the maximum challenge people with disability must have faced and struggled. We can all talk about it, but people who have faced this challenge are the one who are actually suffering because of some of these issues. So I will request you, if you can just very within 5-7 minutes let us know how do you see COVID has impacted the persons with disabilities, and how with your personal experiences and your organization which you are involved with, they can come up with the suggestions which cities start looking at while they are talking about planning a new normal or a new discourse in the development of cities. So Mr. Minocha, for your interventions, please.
Thank you so much, and really happy to be part of this panel. In fact, I would like to begin by saying this, that it seems, while living in this COVID era, that all the time that we had been working for, especially the area of work where I have been working in, we have been planning for COVID for almost past 20 years. So it's the whole work of past 2 decades which suddenly has got highlighted, that it has highlighted the importance of the work that we had been doing and the advocacy that we were trying to do and to push towards use of technology, use of assistive technology, how to use technology to enhance the functionality of persons who because of any impairment lose their functional capabilities of any of their parts. Now, the second part which we have been emphasizing all through has been a universal design, which means that you cannot create separate worlds for separate people. It's a diversity has to be acknowledged, and this diversity is there. We can't run away from this diversity. Every human being is unique in itself. They would be excelling in one way, but having their limitations in other way. And this diversity, if we acknowledge this diversity and the kind of design and the kind of policies we make, if we acknowledge diversity, that there are going to be senior citizens, there are going to be children, there are going to be infants and children and young adults and women and also persons with disabilities. All these are various colors and complexions of diversity. We unfortunately, the whole design and the policies have been assuming that human beings just belong to one category, which is the which is like our superheroes and beauty queens, uh, and that's been the whole struggle all through. I've been working for DAISY Consortium, and which is a standards body, which means that it has been creating standards for digital books. Um, and this is what our whole emphasis on universal design when I bring about. It has proven that I'll give you a small example that for when we started creating accessible books for persons with print disabilities, we obviously had to switch to digital formats because the analog or the paper books were not accessible. And we started using it. We started creating standards for it so that the books, digital books which are created in one part of the world, are interoperable and usable in all the other parts of the world. Now, when not because of COVID, but otherwise also, the rest of the world started moving to digital books. When Kindle books started coming in, Kindles and Kobos and iBooks on Apple and Google Books, etc. All these players, when they started coming into the digital book era, they realized that persons with disabilities have actually already defined what they were starting to do for the rest of the world. And what standards we designed for persons with disabilities became the de facto standards for the industry. So it was the DAISY standard which became EPUB and which was adopted by the International Digital Publishers Forum and now W3C, the World Wide Web Consortium. And the leaders of the technology officers and the secretary generals of the DAISY consortium actually became the technology officers and the presidents of the International Digital Publishers Forum. So that was one very glaring example of how the work being done for accessibility actually fueled the industry growth in this era. And the same thing has got amplified during this COVID era, because now we had been emphasizing that every student with blindness, for example, must have a laptop in their hands when they go and study in the mainstream schools. Now, imagine a child who's our section school child, for example, who was going to the school with his or her laptop, and this during sitting in the class itself, that was becoming an equalizer for that person, because rest of the world was writing on their paper, but this child sitting in the classroom was actually able to read and write in the same script as everybody else using the laptop. But when the lockdown came, everybody else also had to shift to laptop. But this person was already there on the laptop. And all the online classes which were actually now happening, our students at Saksham actually were the first ones to participate more actively in this classroom. And unfortunately, that was not the truth for every child with blindness in this country. It was a very small percentage and very few institutions like Saksham and National Association for the Blind who had taken this on to have these digital infrastructures ready and make them accessible. But one more thing which I would like to highlight as a part of this first question is that we all are now talking about remote participation. We are using Blue Jeans today for holding our webinars. Uh, believe it or not, I mean, I've had my subscription of Zoom almost 2.5 years ago. We had not heard of COVID by then, but we had already started shifting and using this technology because this technology was actually very, very accessible. it saved a lot of money, it saved a lot of time and energy, and we could get a lot of more things done with minimum resources using these technology solutions. But one part, as I said, which I want to highlight is a sad part. I'm a very patriotic and person. I love my country. But when it comes to finding these solutions and applications, if I see, for example, on a Google App Store, that this is an app which is actually made in India, I dread that app right now. 9 out of 10 times, if an app is actually made in India, I can even before downloading it, I can vouch for it that it is actually inaccessible. It's not usable with the help of assistive technology. Whereas, if this app is actually created, even if it is created by Indians for US or UK, that app is ensured to be accessible to all, and the accessibility norms are fully adhered to. So why we shifted to Zoom was that Zoom actually changed the whole life for us, because before that, so many remote participation apps had come in, but all those apps were mostly, did not adhere to accessibility guidelines. Zoom, I think one of the reasons why Zoom app actually grew so much was that every day of our lives, persons with disabilities must have been blessing them from the deepest part of their hearts, because this was the first app of remote participation which was absolutely fully accessible and usable by persons with disabilities also. So it really gave us that opportunity. Unfortunately, today also, when we are talking about replacements of Indian replacements of these apps, although I was trying to refrain from using name, but recently we heard that okay, now there is GeoMeet app has been released, and as we suspected, as soon as I did it, subscribed to it, opened it, found it that actually I can't use. So this is the basic ethos, that before we release our infrastructure, before we create our infrastructure and release it for people, are we really testing it for accessibility, that it is actually usable by all or not? Are we really testing it against those industry standards that ensure accessibility? I think those are few things that unless we make it into part of our daily routine, or the regular workflow of our policy, of our procurement policy, of our development solution development policy, unless this becomes part, I think we will. I'll have to be a dishonest patriot for time being. Thank you.
Thank you, Dr. Manoj. I think you highlighted a lot of issues which actually, when we talk about new normal, we need to really address. Otherwise, we will be doing a business as usual approach. So I think the ideas which you really brought about, and I just highlight, correct me if I'm wrong, you talked about universal design, you talked about standards to be prepared, you said digital infrastructure and technology are important, but they have to be looked at from the accessible lenses rather than just coming up with the digital and solution or technological solutions. So I think these are the very big point, and you definitely ended up with saying that while we all are going to work, and digital has really proved to be a more getting more with the less thing, which is the governance framework which we all have been talking about. I think some of these issues, I think we will be again. You will have to come up with a second round of set of questions. Well, I'll come on the specific on the digital interventions, and so we can really pick up and use those interventions for at a city level. So with that, thank you. I will move to Dr. Alak for her question. And Dr. Alak, same question to you. How do you see COVID has really impacted the persons with disability? Because we have seen major challenges at the city level, and you being a gender person also, I also want, while you are looking at a person with disability, if you can even also highlight a gender aspect towards it, that would be great. And with your organization, Muskan, working so closely with this type of persons with disability, how do you see cities per se and city governance structure should be changed to really address the needs of persons with disability? Dr. Alok, for your comments, please.
So much for giving me this opportunity to share my learnings and my experiences. I would like to say right in the beginning that I have largely worked with people with intellectual disability and their families. Now, this sector in itself is very little understood by the mainstream society, and not only understood, but also there is so much underestimation of their capacities that we hardly have services reaching out to people who need it so much more. Anyway, I'm also a parent as well as professional psychologist by my profession. So, see, I've seen very closely what happens to such people and their families. In fact, during COVID, I realized, as Dr. Minocha also stated, that all the issues got amplified. That means that there were a lot of inadequacies in the systems, and which became even more pronounced in the kind of crisis that this infection has created for the whole society. And what kind of services I'm referring to? I'm basically referring to the training, learning opportunities for people with intellectual disability. Till if we do any kind of survey, you see, although such surveys, accurate surveys are not available as so far, but if we look at the surveys, the 90% of the people are not getting any kind of learning opportunities and employment or the old age support systems and for the families. So what is happening, I'll just try to share some of the experiences when this infection began. Myself and many other parents like me, we were very afraid what will happen if something happens to me or the parent or the child. How will we manage the whole situation? Because you see, if something happens to me, then who will look after my child? Or if something happens to my child, how the system will respond to the needs of my child, which are in some sense, which are unique also, and they have to be understood. We went through a lot of anxiety during that time. And then we wrote to Chief Minister, we wrote to Prime Minister, we had meetings, and we listed out various kind of, the requirement of our sector. Now, I will come to the solutions. You see, what happens is when there is a child with intellectual disability, it requires a lot of resources within the family to deal with the situation. And what are these resources? Of course, besides physical resources, a lot of psychological resources, the knowledge support, the guidance which is needed, and also the hope building that, what all can be done in enhancing the functionality of a child or of a person with intellectual disability. Now, that means a lot of family support services are required. And family support services can be a big answer to many of the requirements of our sector. Now, what I mean by family support services? You see, at the moment, none exists. It is only few NGOs who are working in the field are trying to create that kind of an environment. But otherwise, largely there is no system of family support services. And what does this family support services mean? You see, the first and foremost is how do you nurture the development needs of your child? So, how do you bring up a child so that he or she develops maximally according to his or her potential? Secondly, there's a lot of emotional crisis which happens in the family and which actually takes over so much the whole family environment that a certain amount of dysfunctionality starts coming up in the family. So in that case, a proper counseling where you are sharing with the family that it is not a situation where nothing can be done. A lot can be done, and you can improve your own functioning as well as your child can become much more functional. So that kind of hope building and how to do it is very, very important. Now, then there are so many things which the parents and the other family members need to know. So we say knowledge support to the families along with whatever the government schemes, etc. are there. Now, this family support, I was thinking that particularly during this time, as everybody else, I realized the power of digital platforms. And I was thinking that, you see, there are classrooms are happening, online classrooms are happening. Of course, Muskan also is continuing with its training session online with our students. But at the same time, if we look at the entire cross section of our society, and I will talk about Delhi basically at this time, that if all these things are available on TV programs, which is almost every household has a TV, and if these kind of things, knowledge can be shared with the families on this, a whole lot of family support services can be created through just use of certain platforms. So, I mean, there are TV channels which are imparting education on various subjects. So similarly, the people with disability, and I will say not only people with intellectual disability, even also all other kind of disabilities, where the families, you see, maybe in the dark what to do and how do I help my child in development. The TV channels, short duration TV channels can be created to address this kind of problem. The second is, you see, we still have some scanty services that senior citizens can register themselves in police stations, and the personnel, the government personnel will to some extent attend or address the difficulties faced by them. I feel that the families, there should be an identification of those families where a person with disability is there. The needs may vary. It may be left to the families, but if, you see, I do not have as many resources that I can be very self-sufficient in dealing with the challenges of my child or my family situation, then I can register and say and talk about that what kind of services, support services we will require. It will at least sensitize the government personnel regarding the issues. And at a local level, these things can be addressed by the governmental system. And we have municipal councillors, we have police stations and many other such governmental system. So there is no system whereby the families can go and identify and share the kind of need which is required by such families. Third, accessibility to services is very, very limited. There are a large number of people. I mean, some of us may order things online and it may reach to our house. But what about large number of people? They can't do online. So they have to go out and suppose, and in many families there can be more than one person having disability, or they can be aged parents and so on. And who is going to help them in very basic survival needs, whether it is getting food or it is getting health related services or it is getting medicines or it is getting human support. I give you one example. One of my friends, his daughter got a fracture in the foot. Now he lives in the first floor. Now the foot was put in the plaster, and the family didn't know where do we get a wheelchair, and how do we take my child to the first floor house. So we arranged two people. We arranged the wheelchair and supported this family in dealing with this kind of a situation, and both parents are senior citizens. So, I mean, these kind of services, wherever the severity of disability is such that necessarily demands other people supporting them, these services are entirely missing in our society, except our own local kind of network. And everybody under these conditions, I mean, the local network also have difficulty because, you see, everybody is afraid of catching infection. So even the people who want to ask for these services will hesitate, and those who want to provide such kind of support also would hesitate in this. So you feel at a loss. And I tell you, me and my husband, both of us are 75 and above, and we are so particular. We haven't gone out of the house because we can't afford any one of us, becoming sick, because what will happen? And the similar kind of situation is there with so many more people. So it is high time that the system responds to the need of this sector of our society, and the need is huge. It's a huge survival need. Another thing, you see, which is so much missing.
Dr. Alok,
Sorry?
can we come back to you on the next round, so we can have everyone speak at one round first?
Okay. Sure.
But before I come on the second round, Mamta had some comments to make, so I'll request Mamta if she wants to come quickly, and then we can go to Dr. Dhariwal, please.
No, I can come in at the end of first round, Hitesh. That's okay. Let everyone finish. That's fine. Thank you.
Thanks, Dr. Alok. I think you really brought up a lot of issues, which was actually a personal issue, but which has a much more, for the city governance to look at. And you did talk about strengthening of local networks. You did talk about identification of people with disability. You talked about digital platforms and the family support systems, and how the urban local bodies as an institution of governance can address some of these issues and integrate with the civil society to really be a support, provide the systematic support to that. That's a great thing. So I move to Dr. Dhariwal, who has been a Deputy Chief Commissioner of Persons with Disabilities in Government of India, and understands both policy perspective as well as the local areas and the needs. So, sir, I will request you have your views of how do you see COVID-19 impacting the person with disabilities, and how do you see the policy as well as the practice need to really work together to be a solution and reduce the barriers for this segment here. So, Dr. Dhariwal, over to you, please.
Sorry.
Yeah.
Thank you, Mr. Hitesh. I'm thankful to you for giving me this opportunity to speak and share my experience. And I'm particularly happy about your webinar series, the name of webinar series, that is Building Accessible, Safe and Inclusive Indian Cities. From there, you already said I need to talk a little bit about the policy during this COVID. All the policies, of course, have to be inclusive as inclusive cities. I will talk about the COVID-19 situation crisis. What I found and observed that the policy that the government of India or the concerned authorities came up in the beginning were not inclusive of people with disabilities. In fact, I remember my association with DFID during their PAX 1 program in India, Forest Areas Civil Society Organizations. I was in the selection committee, so I would put my foot down and ask the presenter to let me know whether there is any person with disability among the beneficiaries. If no, then I would request the entire selection committee, project sanction committee, to say no to the project, come back, include some people with disabilities, and then it is inclusive. So similarly, this policy, when our National Disaster Management Authority, Ministry of Home Affairs, and Ministry of Health and Family Welfare came up with the orders, I expected, that was my expectation, working in the disability sector, working for all kinds of disabilities, 21 category of disabilities, varying disabilities, that order, those orders, those guidelines would somewhere mention about people with disabilities. They were not. So we did write to the Ministry or Department of Empowerment of Persons with Disabilities. Of course, we have nodal department. Immediately thereafter, in a few days, Department of Empowerment of Persons with Disabilities came up with the inclusive, disability inclusive detailed guidelines, and much was left to the states and the implementing authorities, which means the state disaster management authorities, different departments of the states, and the district disaster management authorities, who, according to the Rights of Persons with Disabilities Act 2016, are supposed to have the list of persons with disabilities in their districts, desegregated data about the disability, different disabilities, so that they could respond in case of any pandemic, in case of any disaster. So that gap in the policy when it came, and then when the policy came, the guidelines for the person who is on the ground, who will actually implement it, the sub-divisional magistrate, the patwari, the police constable, and the panchayat, unless we tell them what are the needs of different categories of persons with disability. Madam Olak said the specific needs of persons with intellectual disabilities. We had in Delhi persons with hemophilia, persons with thalassemia who wanted blood transfusion. That wasn't there. That wasn't, so they were at a loss. People with disabilities had problem to access food, access ration, access medicines, because probably we had not planned for them. The person who was there on the ground did not know how to handle, how to reach, or how to do this. So therefore, what is important, that reminds me of the cooperation, coordination, and convergence among the authorities, and most important, is a consultation with the people, with the primary stakeholders. That consultation perhaps was missing. I thought if the MHA or the Ministry of Health did not have that kind of insight into all those things, detailed insight about this, the Department of Empowerment Persons with Disabilities should have been called. I don't know whether they were called, or they have gone there. Chief Commissioner for Persons with Disabilities would have immediately told these two authorities to ensure that the needs of persons with disabilities are included. Then, second, the guidelines for healthcare professionals, I would say healthcare providers, the hospital administration, the what do you call that? The doctor, the healthcare worker, the carer, the person with disability and their family. We should have the guidelines. That wasn't there. That wasn't there. Say everything, say all the instructions in the accessible format, as Dipen said. It could be in soft form, it could be braille, whatever, and sign language. It was the NGO sector which came forward and provided all these things in this, and then the organization that CBM India, where I nowadays work for them for some time. So there we developed those guidelines. I will request Mr. Chaudhary to just show these pamphlets. That gives the guideline a small tips for if a person with disability, say person on wheelchair or person on some say this say for hospital administration. What administration is hospital administration is required to do? Accessibility, counter, all these things have to be accessible, have to be provided to people with disabilities. You should anticipate the issues, the concerns of people with disabilities, not one but all the categories of disabilities. A blind person, a person with hemophilia, and so all these things. So you can. That's it. I think that is enough. That is enough. Nobody can read it. I just wanted to show this kind of pamphlet should be available to every doctor, every healthcare worker, every caregiver. Say, for example, we have a panelist on wheelchair. So the people on wheelchair would need would need people some facilities, some equipments or some infectors, some assistance in the hospital when they enter. Say it could be hospital, it could be a quarantine center. So these things. So why it happened is because our policy was not inclusive. Number one. Number two, the policy and policy implementation was not in place. People were not informed, people are not trained, people are not told how to implement this particular policy. So these, I think, these are the concerns, expectations were that this should be inclusive, and the challenges were the people could not access these things, and they had a lot of problems, particularly the service providers, the training, the attitudinal barriers of the people was also a big issue for people with disabilities to access all these facilities. The information wasn't accessible to, and probably that is the learning that we have. This is the learning we have, and we'll have bigger problems in future. And we should also think of the post-COVID scenario. How will we tackle this? How will we skill our people with disabilities to be able to? Another example I have is the use of technology. If we had invested in technology earlier, as Dipinder said, it could have made so much of difference in learning of people with disabilities. You know, the CBM with ONGC invested in a small school, government school in Tripura, to make it smart, to have it smart classrooms, to teach, to make the parents and the children learn how to use smartphones and iPads. And as soon as these online teaching happened, it was the easiest thing for them to learn. They were included. So we can this kind of investment in this technology, investment in accessibility. So if I imagine, say, Delhi or any city, link it. So all these things, the universal design, as he said, universal design, then thinking about the person who is at the lowest, what do you call that, paidan. That's very important, because the entire city population is not India. 70% of the people are there in the rural areas. We have so much of problem in using technology here in Delhi. All of us has some problem or the other. Imagine a smaller town, imagine a village, imagine a poor person who can't afford these things. We have to think of those things. We have to link our policy to this, and the city to the town to the village. That's what I have to say right now.
Thank you, Mr. Nariwal. I think this was a very great perspective, and you definitely clearly highlighted how, if policies have to be implemented, then the capacities at the local level has to be built. You can't just have a policy and no capacities. The only way to link is the skills at the local level has to be improved. Tools to improve those skills have to be worked out. So the person who are delivering the services should be well aware what he wants to deliver and how he should deliver. And I think that's the real great message. And you also talked about strengthening of integration at the local level, that urban local bodies and health, they start talking to each other, and the more convergence and consultation at the local level. I think these are the two key highlights of your address, and I think these are a great area where we are working within NIUA. Is the major focus which we are talking about is the NIUA was created with a mandate to build research and do a capacity building, and I think you have talked about both of them, and how we can build these two aspects within our own mandate of the project, as well as overall a new niche area for an urban think tank like NIUA to really take forward. Because I definitely, looking at it, this area, because what you said, when you talk about a person with a disability, you are talking about the last person who is marginalized. And if you can handle that, you can handle all other marginal people altogether, and you don't need to do a separate thing for them. So that's a great thing. Now I move to, thank you very much, sir. Now I move to Pratishtha Devaswar, who is a young urban professional, or young professional, not urban maybe, but young professional, and who have really, I think, what I understand, has really experimented moving toward within the corridors of the cities, and understand how difficult the infrastructure, the inclusive infrastructure need to be happen at a city level. While we are talking about universal design, we all talking about barrier-free city. I think with your personal experiences of COVID-19, how do you see the cities should really think about? Because one area which we have been also looking at it, post-COVID, and this is, I think, highlighted, a lot of issues were already there. The only thing which COVID did was amplified this issue. And so that's not that they brought it, and now is the time. If we don't do it now, we will never do it again. So to you, Pratishtha, with your experiences, and how cities can really take this as not as a crisis, but as an opportunity to move forward and make it things real transformative.
Thank you very much. First of all, a very good evening to all of you. I am very grateful for this opportunity for me to share my own experiences, and I think it is also firstly a learning experience for me to be listening to all these really experienced people in the field. I've been taking notes of everything you all have been saying. It's very, very insightful. And the topic of the session today is expectations and challenges that people with disabilities face during the COVID-19 crisis. And at the onset, one thing that I want to say is that the expectations that I, as a person with a disability, have are not something out of the ordinary. You know, as a person with a disability, what I expect is I expect my basic right to education, which is now online. I expect my basic right to accessible healthcare. I expect my right to accessible information, and these are really basic things that I think all of us should have. But there are various challenges that people with disabilities have been facing in accessing all these services. Sir just talked about about healthcare, and recently I just got tested for coronavirus, for COVID-19, just yesterday, because I had really bad fever and throat for a week. And one thing that was constantly troubling me and my family was that, what if I test positive, and what if the facilities in the hospital are not accessible? So the first thing we did was go and check the hospitals if they have accessible washrooms, accessible services, and unfortunately they did not. And when we even asked them, when I spoke to them that I might be required to be admitted here, I was told that there's nothing we can do, and you will have to just adjust. And I think that is extremely problematic. The first thing is that healthcare facilities should be accessible for people with disabilities, and throughout the spectrum, for a wheelchair user, for a visually impaired person, for a deaf-blind person, for all of them. Apart from that, to just tell you a little bit about me, I am from Punjab, and about 3 years back, I shifted to New Delhi because I wanted to be independent as a person with a disability, and I always thought that coming from a small town in Punjab, there are not many accessible facilities available, but Delhi would definitely be more accessible. And after 3 years, I can definitely say that Delhi is more accessible to some extent than when you compare it to a very small city like Hoshiarpur, where I come from, but it is not entirely without problems. So, and especially during the time of coronavirus, it became extremely difficult for me to live in Delhi. So for me to be independent, for a person with a disability, independence does not mean being completely alone and not needing anything at all. It is more like interdependence and an environment that facilitates independence for you. And when the lockdown happened, that facilitation of independence for me was completely snatched. I used to live alone there. I had a caregiver that used to come in the morning and during the evening. And when the lockdown was imposed, obviously the caregiver was not allowed to travel to my place. And in the essential services list, caregivers was not added initially, and which was added later after a lot of problems were faced by people with disabilities. And I was also one of those who faced a lot of problems. And for about 15 days, it was extremely difficult for me to manage even the smallest of tasks. Earlier, to even get my grocery and do basic everyday necessity stuff, I had help from my caregiver who kind of helped me navigate that space, because the area where I used to live was not wheelchair accessible completely, and the shops were not accessible at all. So now I was required to go and buy things myself, which made me realize that it is a privilege also to have a caregiver. And what about people who have to really do everything by themselves, and the infrastructure is not accessible at all? So then the next thing that started was that you can call your chemist and grocery shopkeepers to get stuff delivered to your house. And so I am on a daily medication without which for spasms, without which I cannot go for even a day. And every day I used to call the chemist to get my stuff delivered, my medicines delivered to my home, and they would be like, we already have a lot of requests and we cannot prioritize your request. Although I kept telling them that I am a person with a disability and this medicine is extremely important for me, but that is something that is not prioritized. But so after facing a lot of issues there, I decided that it is perhaps best that for now I shift back to my hometown, and perhaps living with my family is going to make things easier. So when I was traveling from Delhi to Hoshiarpur in Punjab, perhaps at that time there was this guideline by the government that nobody can sit on the front seat alongside the driver. And as a person with a disability who is paralyzed chest down, it is only possible for me to sit on the front seat and not on the back seat. I cannot shift myself on the back seat. So in the middle of the road, my family, it was just my mother and me, and we were stopped, and I was forced, कि आप उतरो और and you'll have to sit at the back. And I kept telling them that I cannot walk, and it is not possible for me to shift in the middle of the road like that. But they kept insisting, and they said that it's okay, we can even lift you up and put you back. But in the times of coronavirus, I didn't want to be touched. And only I and my mother know how difficult it was for me to shift from the front seat to the back seat, which might feel like something very easy for a non-disabled person. So while formulating these policies, it is very important that reasonable adjustments for people with disabilities are given importance. And so that's very important. Even when I approached the local police station in New Delhi to arrange for a movement pass for my caregivers, you know what they said to me? They told me that it was your decision to live independently. आपको आप person with a disability हो के आप independently कैसे रह सकते हैं? बहुत शौक था ना आप देखो. Then they spoke to my father. I told my father to talk to them, and they said to him that we suggest आप अपनी बेटी को इंडिपेंडेंटली मत रहने दो. It is really harmful for her and बहुत ज़्यादा प्रॉब्लम हो जाएगा. You can see what is happening. So once you take her back, we can allow taking her back, but don't send her back again. And now they don't know that I'm going to Oxford to live alone. But it's what if somebody, so this really hampers the confidence also of people with disabilities. When you see that people, the authorities, the society, nobody is there to support me. They don't realize that there are certain limitations that I have that need to be taken into account. And yeah, so one thing that I would like to also talk about education, but I'll do that perhaps later because I'm a student. And the UGC guidelines have completely missed talking about people with disabilities. And so one thing that I would really like to say before ending this is that obviously on this panel we have really illustrious people who can talk about things from the policy perspective. I am yet to study Master of Public Policy at Oxford, so I don't think I can really comment on that now. But one thing that I truly believe in is that, this is for all the people watching, is that inclusion starts with I. If you see the spellings of inclusion, it starts with I, and each one of you, all of you who are listening, you have tremendous power within yourself to make the society more inclusive for people with disabilities, for the marginalized communities. For a teacher listening right now, if you're a teacher, I really insist that you ask your students if anybody has any access needs before you give your lectures online. If you are a chemist, please prioritize the needs of medical needs of disabilities. If you are just a grocery shop owner, I really insist that you take into account that a person with a disability might not be able to come to your shop, and if somebody is there in your locality, try delivering stuff to their homes. And in your own space, in your house, your community, your office, in your state, just at your own level, there's a lot that you can do, and I really hope that you will. Thank you.
Thank you, Pratishtha. I think it was really based on your personal experience and how you really felt, and you related this with exactly a topic, what is an expectation, and your expectations for ordinary citizen or person with disabilities are not different, and they are same. It's the change which the authorities have to make. And you brought a very great point, which is, I think, across the thing, is also not only the capacity or skills, but also how do you bring behavioral changes within the staff at the local level, that they can start empathizing, not sympathizing towards the person, and understanding their actual needs. So I think that's an excellent point. I know we are running out of a time with the so I'll request Mamta to come in, and then maybe we can pick up a couple of questions, and during the questions some of the second round of questions can be answered. So Mamta, over to you.
Thanks, Hitesh. So great conversation, great insights. We always think we'll keep to the time but the conversations are so interesting and so insightful that one doesn't. I just want to wrap up, pick up from everything that all the four panelists said, 4 or 5 key big points that have come, and then also turn to the questions. So I think one thing that came across very clearly was around digital and how digital is now the way to go, how digital is improves accessibility and connectedness, but how we need to ensure that the guidelines and the standards are truly accessible, and that digital is also inclusive, that it's affordable and it's accessible to the poorest. I think the second very important point that came in was around support systems, whether it is a registry that Shantiji talked about, how do you access to services? The guidelines, I live in Gurgaon and the DC here was issuing guidelines every second or third day, and we used to see that there's nothing around the kind of stuff that Pratishtha was talking about, the proportionality of it. These are easy things to do. So these are not huge policy shifts that we need. So how do we build in a very robust support system where this registry of people with disabilities possible, the support services possible, and this is something we will need over the years to come with the COVID response and COVID this thing being in place. The other big point is around policy integration. How do we make sure that our policy narrative is right? Because if that's right, we can hold service delivery, we can hold people to account to deliver it. So to make sure that we are very actively, all of us here are very actively looking out to making sure that all our policies reflect the perspective and bring in the perspective of people with disability, and that could be including the hospital services. That's been one major learning of COVID, that COVID has come at the expense of a lot of other health diseases, and people who need regular care and regular medicines, how do you build that in? All this thing, again, underscoring the point about interdependence. And I think the final point that Pratishtha you brought out, very, very important, is around the independence and the dignity, which we sometimes tend to ignore. We just think that they are people with disabilities, so it's dependent, but that's not the way it is. So I think these are the 5 big things that I take away from this conversation. And this is not the last of the meeting, so we'll all have opportunities to connect again very regularly, hopefully on a monthly basis, picking up maybe one of these issues and delving deeper into it, looking at what are some of the solutions, what are some of the platforms where we can bring change. So that's it from my side. That's how I see the sort of big points coming out of this. Hitesh, do you want to add? And then we can look at some of the questions that are there. A lot of questions have come.
I think you had articulated all the points pretty well, and I think I had already done while I was moving from one to another. So I don't think we have. I think let's go to the questions, and Nanda has taken a note of the questions, so he'll take one by one and pick up the questions. Nanda, please, over to you.
But before we do that, the first question is, or first comment is, a big thank you to Atul and Manisha for their excellent support throughout the panel discussion. So kudos to both of you. Thank you so much for making it active. Over to you, Nanda.
Thanks. Nanda, please.
Right. Thank you, everyone. I think a couple of things quickly to check in. Although we had planned a second round of questions, just primarily focusing on each panelist. But I'm not sure whether we can go into the details of each of the question. But nevertheless, I think I'll request Mr. Manocha to quickly share any additional insights. But before I get into the questions, Mr. Manocha, would you like to add on anything that, because I think you had a hard stop. Do we still have a hard stop? Can we continue a little longer than 4 o'clock?
Yeah, I think I'll have a grace period of about 15 minutes now. I think we are just touching the hour, so in 15 minutes I'm there. So one thing which I can just say is to remember is, I think the time has come when we should be saying no to inaccessibility. I think that's a mantra, that almost like a mantra we need to follow. Say no to inaccessibility. If there is something which is inaccessible, we need to say no to it. We can't use it. We should not be deploying it if it is inaccessible. So I think that's a very that can be a very powerful thing, because especially when we start saying no to things thrown at us, that if they're inaccessible, we won't use it. I think that is a change. And especially when it starts coming from the government. Government is a lifeline for all the businesses right now. So if like, for example, there was a webinar which was scheduled for today in the morning, and that webinar had to be postponed because the government department said that the platform which was being used, which was hired for that, was actually inaccessible. And the department said, till you make it accessible, we can't use your platform. Either you make it accessible and tell us within 2-3 days, and we will then hold it. Otherwise, you will have to change the platform, and we'll move out from your contract. Now, that obviously is very powerful. That will bring about the change. Second thing I think is that it can't be an afterthought. It can't be a retrofit. I mean, if you buy a new car right from the showroom, you don't want to take it to a body shop to get the whole thing changed. You can't say that I'll first of all make the product, make the service, make the building, and then I'll think about accessibility and retrofit it. So it's been said very commonly. I mean, but I don't know. I mean, it just doesn't come into the practical implementation. So every time when anything is being made, we say, let us first of all make it, and then we will test it for accessibility. I think by that time we are already too late. So that I think these are few things, which one or two things which, if start happening, then only we will see the change.
Definitely. I think on that note, Mr. Manocha, I do have a question from one of the attendee which is marked against you. Thank you, Apurv, I think, for putting this question. This question, Mr. Manocha, I'll quickly summarize that. It's about the procurement, and I think it's also very relevant looking at the current context of Atmanirbhar, and what also the opening point that you made about the make of the products. So it talks about public procurement can be an effective policy tool to create a larger market for accessible products. And in this, the question is, how can this be practically replicated in India? At what ministry or department should the advocacy or intervention start? The example that was given was for accessible products and services was USA and Europe. And the question is to Mr. U. Manocha.
No, thanks a lot for bringing this thing up. I think it's a very proven point that it's a procurement policy which really brings about change. We have seen this, as you said, in the whole European countries. And now the new act which is coming, the Accessibility Act, which is coming in. We have had a procurement policy for a long time in Europe and in US, and that is why I was saying that so many products, when we see that those products are created for the US or European markets, we are almost ensured of at least one thing, that they will be accessible. And it is primarily because of this procurement policy that is happening. But obviously, putting a policy in place is not enough. I mean, in India, our disability law, the law for the rights of persons with disability, already actually acknowledges that the procurement policy is right there in our law and in our e-governance policies and all that. But what is not there is that, how do we define accessibility? We say that, okay, we will acquire accessible product, but what is an accessible product? So these are standards to be put in place to measure. So the definition of accessibility has to be there. So what is the definition of accessibility? That if you have, I think the most understood example there is that, okay, if you have to make a website, what do you mean by accessible website? That it has to comply to web content accessibility guidelines. So that's a standard against which you will have to measure it. There are tools to measure it. There are agencies who can validate it. So all that infrastructure has to be in place, and this is not something which can happen in just one department. I think there's one department which can sort of lay down the basic rules of engagement, but the implementation really has to happen in almost each and every department. It's a cross department thing, that procurement at every level has to be adhering to these things. But the ecosystem clearly has to be there. The policy, the legal framework, that if things are not accessible, what is wrong that is going to happen if it is not made accessible. Number two is, how do we define accessibility? Means that we have to measure accessibility against a set and a norm and a standard. There has to be a standard for accessibility of various things that we are going to procure. The third thing is, do we have an accessibility checker against those standards? And are there third-party validations happening that before a procurement or before a release, before anything is made available to the public, is there a system in place to certify that yes, that is actually accessible, and then only it goes for the public release. So I think that ecosystem is something which is to be there, and we are just maybe 5-10% of this whole ecosystem right now in the procurement policy.
Well, thank you so much. I think two key words from the response I would say. One is the ecosystem approach, which we also believe is the way to go about it. And second important point, I think, Apurv, I hope you have got the response that we are looking at, which is standards, like emphasizing standards first and then and doing it and by default and not doing a retrofitting of a product later on. Thank you, Mr. Manoj. Again, a follow-up question, but I think you might have already answered it, but nevertheless, I'll just call it out, which is, so there are many countries with government policies to make websites accessible. It could sync with what you have just mentioned, but the challenge, I think the question is, what can be done to get these policies enforced? Any quick thoughts, Mr. Manoja, before I move on to the next panelist questions from your end?
To put thing, I think there's now as I said, inaccessibility now needs to be challenged. So we have laws, even if there is no standard. I think that is not an excuse. So inaccessibility needs to be challenged, and as I said, we have to follow this mantra: say no to inaccessibility. So once government departments, once some of our conscious people, more sensitive people, start saying no to inaccessibility, even if this beginning is small, it is going to have a huge impact. I can tell you that. But we just need to be strong enough to say no to inaccessible products and infrastructure.
Definitely. Over to you, Mr. Dharyal. I think you were raising your hand. Would you like to add on something to the
that procurement? Thank you. As State Commissioner for Persons with Disabilities in Delhi, I had issued directions and my recommendations to all the authorities, all the departments of Government of Delhi and the local authorities like municipal corporations, etc., that they must not procure anything, be it any equipment, be it any software, be it any service. By service, I would mean it could be, say, don't approve any clinic unless it is accessible. So we have the standards on built environment. We have the standard for, as Mr. Mircha said, on digital accessibility, web accessibility. We have standard for transport. Many more other things we want that you cannot procure. You should not change your procurement policy. Now the requirement is to see that people monitor it.
Right. So thank you, Mr. Dharyal. On that note, I was just trying to check another question. I think this is again a very relevant one. I think Dr. Alok, you were trying to highlight that while you were presenting or sharing your experience. I think it's a question that might be useful for us also as a program team at NIUA, which is trying to make Indian cities more accessible and safe. The question is around how do you see capacity building as a measure to support the family structures? Like how effective can the capacity building of family systems be helpful in emergency response systems? Because I think most of the responses and the personal experiences do highlight how much are we actually aware of, be it what Pratishtha was highlighting about being stopped on the main road, like on the journey, although the person was trying in his own sense was trying to help. But how do you? That's a different context from an institutional perspective. But from a family structure perspective, like what do you think should be the role of capacity building? Over to you, Dr. Alu.
First and foremost, the capacity building is right information and knowledge and understanding. So, if the family gets the right kind of information and understanding about the situation, about the what can be done, itself is a very powerful way of empowering the family. And secondly, you see the accessibility to services. Now, I am not talking about accessibility in the sense that services are there and they should be made accessible. There are services are so scanty that by and large, and what do I mean by services? I mean by services like schooling, appropriate schooling. That is very important. The appropriate schooling, the right kind of training for employability, then suitable employment options, and of course, safe living, because you see, there are certain sections of the disability sector who would always require certain amount of assistance and supervision in their daily living, particularly when parents are not there or when they get old and so on. Now, these services are so scanty that it's very bad situation, and families do not know what to do.
Right. Again, a
Yeah.
follow-up question on the same point. I think at what level? I think the question is the suggestion is well taken. I think the participant does acknowledge that, and the point is developing family support facility. So how does one decide the scale? Like whether it should be at a neighborhood level or at a city level? Again, it's a question to all the panelists, but maybe we can start with you and then move on to see what do we, how do we see for a facility like that to be panned out?
See, what I feel is that there are 2-3 approaches to this. One is the identification. If there is a system that I can go to my local counselor, or I can go to my local police station and say that my family has these kind of challenges, and I inform them about it, and also inform them about the kind of support that we would require. At least there should be some system whereby I can report that I need help. Then secondly, now comes the role of a lot of NGOs like us, that how do we help the system to deliver those kind of services, how to do it and what to do it. And there is enough experience with the people who are working in the field. Their problem is they can't scale. They remain always limited in terms of providing these kind of services. So the NGOs can be taken into the fold. But the problem, the issue, the real challenge is that sensitizing the system for the need and then developing systems whereby the governmental systems become more responsive to the needs of people with disabilities.
I think that's a very valid point. If I can come in here, Nanda, and just to say, we are looking at developing some kind of a pilot around it, and it'll be useful to build that input in, right, Nanda? That's one of the things that we do want to test out as part of basics. Yeah, we are past those 15 minutes also, Nanda, that you were just saying. How do you want to wrap up, or you want to continue?
There are a couple of questions. I think it's getting.
I just wanted to come in. I just wanted to come in on this particular thing. My suggestion to the Delhi government was, I have passed an order on that, and there is a recommendation in that order that the government and the NGO sector should come together. They should have a pilot at one place, and then these facilities should be made available, say across Delhi, across state, in different districts, so that people have those facilities available, and these facilities are run on an efficient manner. The second point is capacity building of people, or not only of the parents and all this, but also the officers or the government functionaries is very critical, particularly of Persons with Disabilities Act and all this. Say, for example, when this ex gratia of 1,000 rupees per persons with disabilities, women and older people was announced by the government, there is a provision in section 24 of the RPWD Act that at least 25% extra should be there for persons with disabilities. That I have written to the government, but then probably if they had that knowledge, that extra should have come. Similarly, we have had packages for industry, package for this, that. What I am seeing right now, my observation is many of the NGOs in the cities, most of them are in Delhi or elsewhere, are completely dependent on donations. We do not have any package for them. I have written again on CBM platform. I have written for that that there should be a package. There should be an economic package for revival of these NGOs who are actually providing those services to people with disabilities. Otherwise, they will not have these services at all. That's one. Then they can't live with dignity. Then third, the Center for Accessibility for Built Environment, of which I am executive director also. I have got 3-4 connections with different organizations. One of the aims of that organization is to ensure to help the authorities to train people on accessibility, and also implementation of the rights of persons with disabilities provision and the policy on disability, and how to make the cities accessible, how to make the facilities accessible. That is one. And collaborate with the institution, like we have on recently we are trying to have a collaboration MOU with Gautam Buddha University. This kind of things will have to be done, because if you leave it to the government, it may not happen. If you leave it to the NGO sector, it will not be enough, because the scaling up will have to be done by the government, and we can create good examples, good say for replicable models, and then go ahead. Thank you.
Thank you, Mr. Daryal. I think, Mamta, I think on that note, I think there's one interesting, of course, there are a lot of interesting questions, but there's one which might be very relevant to the larger social sector at large, and I would like to request Pratishtha to respond on this if you feel it is relevant, which is what sort of education to be implemented to avoid the bullying faced by persons with disability? I think that's a question that Pratishtha, would you like to respond? And I think in addition to that, there are other questions. Just a minute, Pratishtha. I think we will, of course, make a note of it and will respond to all of that, and also create a summary of the recordings and share it with the participants. And over to you, Pratishtha.
I think to mitigate or avoid the bullying that people with disabilities face, it is not something that can entirely come out of formal education. It is something that really needs to start at home for parents and families to just nurture a child in a way that he does not see those kind of differences, does not bully anyone for that matter, and especially people with disabilities. And apart from that, I remember in our school we used to have a life skills lesson, and they used to teach us about moral values and ethics and all of that. And I don't remember being talked to about people with disabilities and how the person first approach, how a person with a disability is supposed to be seen as a person first before you see his disability. So I think these kinds of things perhaps could be added in the education curriculum as well at a very young age, because when you grow up, you are already your mindset is already focusing on the stereotypes that are in the society. So at a very small age, if in these life skills lessons and at school, if something of that sort can.
Nanda, what we can,
I think what we can do is look at all these questions and make sure that we, when you're doing the summary, you also respond to them. One question in particular that I wanted to pick up, and I wanted to say that it links with the entire debate we are having, is around how does the city decide how much infrastructure should be provided for persons with special needs. There's no percentage. I think it is all infrastructure has to be accessible and it has to provide to people with special needs. It's exactly the point that was being made earlier, that we need to learn to say to inaccessibility. Everything has to be accessible. So yeah, I think that's it from our side. Nanda, you want to wrap up, Hitesh, and talk about the next few seminars that you're planning, and then next time we'll plan it a bit for a longer time, so that we can wrap up early, but we can.
Yeah. No, I must say that it was such a learning experience for me as an individual, and I think all of us has been. So, looking from Pratisthas to Dr. Alok, Dr. Dhariwal, and all of them, have brought up so many points which we are struggling within the basic. How do we really pinpoint how to move forward? So I think all of them are good, and I will request as a part of this webinar, we'll definitely continue working and having your thoughts and advices. I think I request within the team, we will try to work if we can have some kind of advisory groups on some of these issues where we can bring you people in on a regular interventions, and while we are working towards the rolling out of the project at the ground, because some of these discussion point which came up, if you look at a commissioner's point of view when you are working in a city, and Dr. Dhariwal will appreciate that. For him, unless you start telling him what to do, he is totally lost, and he will not be able to do unless you really give a very clear focused guidelines or a focused pointers, because he doesn't even have a time to read so many books and knowledge products. So how do you really create those capsules where you give us that messages that everything has to be accessible? There is no inaccessibility in every will not be worked out. Even a DPR, which as which comes for approval at the city level, what are those checklist points that he will pick it up? That is this DPR accessible or not? Even a starting point of that. If it is not accessible point of view, lenses have been applied to it, that he will not look at those type of DPRs and move forward. And so, how do you ensure within the day-to-day operations of the urban local body that they really start checking any intervention which they make is accessible? So I think that's where we need to really target ourselves, and our communication has to be that language which they understand. So I think these are the 2 points, and I think we will be working in the project to on those areas. So thank you very much on behalf of NIUA. It was, and we really value your suggestions and your, recommendations, and we'll try to see how we can build up some of them within our discourse and contribute to the both at a policy at the project level. Thank you very much.
Right.
And thank you participants for joining, and it was a huge participation. We started with the 60 and we are ending with 58 participants. And so I think there was a huge interest, which shows that there was no dropout. So again, thank you for all of you. We'll keep continuing a series of this development. Very soon we'll come up with a new thing and new area, maybe very specific topics, and take it forward. Nanda, you want to have a closing remark? Then please go ahead. Thanks.
Definitely, sir. Thank you. And I would like to start with thanking each one of you. I think the panelists, it has been a really engaging one. Although Mamta and Hitesh sir have been asking me to close it off, but I would say the kind of conversations that we the points that are coming up, I think this is going to help us a lot in while we continue to design our program in a flexible manner to an extent where most of your points, I think some of the points that you have highlighted are being taken on board as we speak, and we will be coming back to you all, both panelists and also the participants, a kind of a detailed summary of what happened today, so that we all know what was discussed and how much of it can be taken on board from the program immediately. And followed by that, I think both Hitesh sir and Mamta ji has highlighted, this is a webinar series. So it's the first of the webinar series we have started, and the the learnings that the insights that we have drawn from this one will flow into the next one. There are certain questions which might be the topic for the next webinar itself. It could be procurement, it could be the infrastructure related questions, it could be planning related questions. So I request you all to kindly look out for this space on the NIUS website, on the SmartNet, where we were going to highlight our next webinar series event. And also, in addition to that, I think to each of the questions that has been posted in the Q&A, we will be sharing a response on that with a feedback being incorporated from the panelist itself. Uh, and a very big thanks to all the panelists and the participants for staying this long. I could still see 54 around, and it was, I think, at the higher side, it was around 120 plus, uh, and this would not have been possible without the support of the team at NIUA, the larger team, and also the core team of the basic program. I would like to take this opportunity to thank Mr. Utsav Chaudhary, Ms. Kanika Bansal, Ms. Prabha Roy, and Ms. Divya Jindal, who have been part of this, were part of this basic program at NIUA, and we look forward to continuously engaging with you on various occasions while we go into the implementation phase of the program and all the way to the impact evaluation of the program. There's a good 1.5 year left in the program where we'll be working with a couple of cities. And on that note, thank you so much. And
thank you, NIUA and DFID, for organizing this program on persons with disability. So nice. Thank you.
thank you.